Hi, I'm Gabrielle Anusbigian, and for my RP, I'll be comparing art, music, and writing therapy and their ability to combat teenage stress symptoms.
What are CAM techniques? Complementary and alternative medicines have been growing in popularity and are commonly used in conjunction with mainstream medical practices. Examples of these therapies include art therapy, music therapy, writing therapy, of course, hypnotherapy, acupuncture, and herbal remedies.
Each of these therapies have been studied extensively in their ability to reduce the symptoms of a variety of mental illnesses, including trauma, stress, depression, post-traumatic stress disorder, and substance abuse disorder.
According to the American Music Therapy Association, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. Music therapy treatments include lyric analysis, relaxation training, songwriting, music games, and listening to and playing music.
In a study performed by Cynthia Vanderqueege, adults living with serious mental illness used songwriting to explore their journey between illness and health. The goal of this study was to gain a better understanding of what it's like to live with mental illness, and this was possible due to the use of songwriting. A lot of the themes of these songs, despite being created by different participants, had a lot of overlap, which helps to create a full picture of what it's like to live with these illnesses.
Identity, control, social engagement, and hope are the most prevalent themes observed in the songs, and they're all identified as catalysts that progress the journey toward illness or health.
Besides the ability to reflect upon a psychological experience, music therapy can help improve upon it also.
Positive emotional change, relaxation, and a decrease in anxiety, anger, depression, and stress have all been observed as beneficial aspects of music therapy treatment. According to the Art Therapy Association of America, art therapy is an integrative mental health profession that enriches the lives of individuals, families, and communities through active art making. Examples of art therapy include incident drawings, the painting or drawing of emotions, contemplation of existing work, sculpting, or the creation of an art journal. Art therapy has been observed to decrease denial, reduce opposition to treatment due to its enjoyable nature, provide an outlet for communication, lessen shame, and inspire individuals to take action.
Art therapy can be very beneficial for teenagers specifically because it is approached with far fewer preconceived notions than regular one-on-one verbal therapy because of its representation in the media. And it also allows teens who don't always fully trust adults to speak objectively and metaphorically about something they create rather than about themselves.
According to the American Psychological Association, writing therapy is the use of logs, questionnaires, journals, and other writing forms to help people heal from stresses and traumas.
In her journal published by the American Psychological Association, Bridget Murray covers all of the benefits of writing therapy, one of the largest being it improves immune function a ton, and this is because when practiced correctly, it is able to reduce cortisol levels so much that the stress that makes disease worse is reduced. And this, in her study, was shown to be really beneficial for patients living with severe asthma and severe arthritis. According to Judith Pizarro, the extreme benefits of writing therapy, which include reduction in cortisol levels and improvement of immune function, are sometimes outweighed by the negative effect that this therapy has on short-term mood. It's because of this that people are less likely to continue their treatment, and for that reason, less likely to see the full range of benefits that writing therapy has to offer. And for teens specifically, art and music are just so much more relaxing in the short term and in the moment that they're much more likely to continue practicing those kinds of therapies.
According to Bridget Murray and Heather Stuckey, writing therapy can also reduce depressed mood, decrease stress, and also decrease social dysfunction, but these benefits are observed after a long period of time.
After having learned about each of these therapies and all the benefits that they have to offer, I decided to make my own test to compare them and see which one is truly the best. However, this test is not scientifically accurate, nor does it yield any quantifiable data. However, It's written in a way that it can be replicated by other scientists and they can use it for their studies.
The first test group is the art therapy group. They begin by taking a mood questionnaire and having their heart rate measured. Then each participant will draw in a silent room their morning routine, each step of what they do when they wake up. And then their heart rate will be measured again, and they'll start the second test, where they draw what's been bothering them the past couple of days, rather than a neutral subject. Then their heart rate will be tested one more time, and they'll take the same mood questionnaire.
In this test, the group that drew their morning routine experienced a decrease in heart rate from before and after the test, and the group that drew what was stressing them out experienced an increase in heart rate from before and after the test.
Next is the writing therapy group. It begins the same way, with a mood questionnaire and heart rate test, and then is followed by 15 minutes of quiet writing about each participant's morning routine. Then their heart rate will be measured again, and they will begin the second test, which will be 15 minutes of silent writing about what is stressing out each participant, followed by another heart rate test and the final mood questionnaire.
Similar to the art therapy group, in the writing therapy group, the participants' heart rate decreased after writing about their morning routine and then increased again after writing about what's stressing them out. They also reported to have felt a little upset after the portion about their stresses.
Similar to a test performed by Marian Tama and others, the music therapy group will compare nature sounds to relaxation music that has words in it. The test will begin with a mood questionnaire and heart rate test, and then group 1 will begin by listening quietly to 15 minutes of relaxation music with words. Their heart rate will be tested again, and then they'll begin the second test, which is 15 minutes of nature sounds, followed by another heart rate test and mood questionnaire.
In the music therapy group, there was very little to no change in heart rate between the acoustic music with words group and the nature sounds group. Moving forward, I'd like to perform more trials of each of these tests, and I'll include the results in my paper if you'd like to check it out.
Thank you so much, Mr. Van Meter and Dr. Andersma, for all your support and guidance throughout this process. And thank you, everyone, for watching. If you have any questions, feel free to email me.